This is an Alliance 011106. It's also called alternate trial. So it's a phase 3 neoadjuvant adjuvant study of endocrine therapy in patients who are postmenopausal with clinical stage 2 or 3 estrogen receptor positive HER2 negative breast cancer. So in this report, we're analyzing baseline tumor samples from these patients before they went on neoadjuvant treatment, and specifically correlating the molecular subtype with PAM50, their relationship to on-treatment Ki67 response, and also at the time of surgery after 6 months of endocrine therapy, what we call a PEPI score. So this is a preoperative endocrine prognostic index, so whether it's 0 versus not. So previously we've shown that in this large neoadjuvant study that patients, about 20% of the patients who got on the neoadjuvant endocrine therapy, they have a high Ki67 at 4 weeks, which means Ki67 over 10%, and this means persistent elevation of their cell proliferation despite endocrine therapy. So these are endocrine resistant patients. And then these patients are triaged to neoadjuvant chemotherapy. And then we assessed, the residual cancer burden and PCR rate, and in that cohort it was very low. So in patients who have low Ki67 on treatment at 4 weeks, they continued on their neoadjuvant endocrine therapy, and then we calculated their modified preoperative endocrine prognostic index. So when you have a score of 0, meaning that if they have a Ki67 2.7% or less, and also with the pathologic T1 to 2 and 0 disease, these patients do very well from previous studies. So we found that about 20% of the patients enrolled on the study had a modified PEPI score of 0. So what we're doing here in this study is to investigate whether the different intrinsic subtypes can correlate with resistance to endocrine therapy by, on treatment high Ki67 or sensitivity to neoadjuvant endocrine therapy by the modified PEPI score of 0 at the time of surgery, and also for those with endocrine resistant disease, what's the rate of PCR if they were different subtypes. So what we found is that patients with luminal A disease, which represents about 50% of the population, they have a very high likelihood of achieving modified PEPI 0 compared to other subtypes. But also patients with non-luminal subtype, which we found, although this is a trial of ER-positive breast cancer, there's a small fraction of patients that have non-luminal subtypes. They have a very high likelihood of having a high Ki67 on treatment. But interestingly, those patients who went on neoadjuvant chemotherapy subsequently had a higher PCR rate. So the conclusion from our study is that the intrinsic subtypes by PAM50 could have potential utility in directing what neoadjuvant treatment these patients may have. For example, if they have non-luminal subtypes, perhaps neoadjuvant chemotherapy would be the way to go. But if it is luminal A, neoadjuvant endocrine therapy, perhaps even without an on-treatment biopsy for Ki67 would be appropriate.